If you've been diagnosed with vascular disease, you might be sent to a surgeon for invasive surgery. That's scary stuff. But what if there was another way? A less invasive way to keep you alive and thriving? My guest today might just have the answer you've been looking for. Welcome to the Fabulous Health Show. I'm your host, Terri Chrisman. I'm a whole food, plant-based nutritionist, and this show gives you the tools to help you obtain optimal health so that you can live a long, happy life and age with grace and vitality. It's episode 57, and I am joined by Dallas-based Dr. Rizwan Bukhari from the North Texas Vascular Centre. And he is here to tell you that heart disease and vascular disease is not necessarily a death sentence. And in fact, it can be the start of a brand new life. Welcome to the Fabulous Health Show, Dr. Riz.
Well, thank you, Terri. It's a pleasure to be here. I'm excited to join you for this conversation.
Thank you. So firstly, tell everybody that's listening, what is a vascular surgeon and what complaints do patients present with when they're first referred to you?
Well, a vascular surgeon is the surgeon or the doctor who primarily specializes in the arteries of the body. There really are a couple of different doctors that treat arteries. There's the cardiologist and the heart surgeon who primarily work on the arteries of the heart. And then there's the peripheral vascular surgeon like me who takes care of the arteries everywhere else in the body. So I might treat arteries in the neck or in the abdomen or the legs and even the arms.
And when people come to you, what sorts of conditions do they have that makes you need to work on their arteries?
So typically there's some kind of the major categories that I treat are people who are having strokes, secondary to blockages in the neck arteries, or people who have leg issues. They either have pain with walking or pain at rest, or even gangrenous changes of their feet. And so there's circulation issues with the legs. I also treat aneurysms in the belly of the abdominal aorta. And then, there are some other things that I do, such as dialysis access work, and then also leg vein work. So some vascular surgeons kind of do all those things, and some specialize in certain areas. And my actual area of specialization within vascular surgery is limb salvage. Limb loss is a huge problem in the United States today, and I focus the majority of my practice on that.
Wow. So what are the surgical and medical options to people who are in the state where they may be at risk of losing their limbs, and how successful are these interventions?
By the time somebody is typically referred to me, they have very advanced vascular disease. They have advanced blockages in their arteries. And so this is typically at a stage where they're going to require some sort of intervention, either through stents and angioplasties, which I do, or through some more advanced invasive surgical procedures, such as bypasses. So those are kind of what people can expect when they have these advanced problems.
So those sound like really scary surgeries to have. So if a person comes to you and that's all you do for them, what's the prognosis for those people? Do you cure them by doing stents and angioplasties in their vascular system?
That's a really good question. And I'll start by what you asked at the end is, do I cure them? And the answer to that is no, because what they have is a chronic disease that they've acquired over a lifetime of habits. And so what I'm actually doing is fixing a problem, like a plumber might fix a problem in the house. But if what caused the problem continues, then they're going to continue to have more problems. In a nutshell, I'm not curing them. I'm just, I call it plugging leaks and putting out fires.
Wow. And that must be pretty soul destroying. I remember when I saw you talk a couple of years ago, you said that 50% of the people that came to you for help actually died.
Yeah, by the very nature of the type of patient I get, they have advanced disease processes. Most of them have diabetes. Most of them have coronary artery disease or heart disease. Most of them have hypertension. Most of them have hypercholesterolemia, high cholesterol. Most of them have high triglycerides, which is high fat. So they all have chronic conditions. All of these, by the way, are the risk factors that create peripheral arterial disease or vascular disease. So yes, I mean, my patients are pretty sick. They're often, they may not feel sick or look sick, but they're kind of like icebergs. 90% of the problem is under the water. Because of all of these chronic conditions that they have, a great number of my patients do die within 5 years. Typically, we have a statistic that says somewhere around 50% of these type of patients die within 5 years. So it's not a good place to be. And that's actually, when you said soul crushing, me being a vascular surgeon is actually what prompted me to look at other solutions and say, well, how can we better treat these patients, but also how can we prevent people from getting these problems?
Which brings me to my next question, because it was getting a bit dark there. You've decided that there is a better way, and I love this better way. So what options do you personally give your patients in regards to treating them, and particularly in relation to lifestyle modification?
Yeah, good question. So like I said earlier, unfortunately, by the time a patient gets to me, their disease is so advanced, there's a high likelihood that they're going to need some sort of intervention. I do specialize in minimally invasive interventions, so I do a lot of percutaneous techniques where I do a puncture in the groin and do balloon angioplasties and stents and clean out the arteries. But a lot of them also still end up getting major surgery. That's not all I offer my patients. I don't want to just be a technician and operate on them and then send them away. I also do intensive lifestyle changes, or I counsel them on how to make intensive lifestyle changes that can hopefully improve their overall outcomes, not only for the surgeries, but also improve their health further on down the road. If we can teach people to reverse their diabetes, fix their cholesterol, lower their triglycerides, improve their hypertension, all of these risk factors for atherosclerosis, they will do better in the long run, and they'll be healthier in the long run. So they'll have less chance of morbidity and mortality down the road.
So you're talking about a bucket of disease states, aren't you? You're talking about pretty much all the bad things that can happen to you. And are you telling me that if you change your lifestyle, all of these things are going to get better? Is that what you're saying?
I am saying that. And I think the reality is about 80% of the chronic disease that we treat in the United States today is secondary to lifestyle. It's about the choices we make about, and it's not just food. Food is extremely important. I'd say food is at the center and the core of this. It's what we expose ourselves to typically 3 times a day, every day of our life. And if we make good food choices, we're going to be healthier. If we make bad food choices, we're going to be less healthy. But it's also other lifestyle things such as sleep and exercise, avoiding risky behaviors such as drugs and tobacco. So there is a bigger lifestyle picture that I try to teach my patients. But I do focus on nutrition because if you make intensive nutritional changes, it's amazing to me how quickly results come about. You can take a pill for diabetes for your entire life, and it's not going to cure your diabetes. All it's going to do is manage your diabetes. You still have the diabetes, and therefore you're going to still have the ravaging effects of diabetes, such as kidney disease, vascular disease, blindness, peripheral neuropathies, etc. But if you make intensive lifestyle changes, a great deal of type 2 diabetics can actually improve or reverse their diabetes. And so with those intensive nutritional changes, your diabetes is gone. You're not just managing it, you can make it go away. And I'd say that's true for somewhere between 50 and 80% of people with type 2 diabetes. Type 2 diabetes is also directly proportional to the obesity in our society today. And we are, unfortunately, an overweight society. I used to tell people that, 2/3 of Americans are either overweight or obese, but that number has gotten worse, and it's now 3/4 of Americans are either overweight or obese. And if we can address this obesity epidemic we have, it's also going to address the diabetes epidemic we have.
Yeah, exactly. So we're going to get some free advice from you now. Specifically, what do you tell people to eat?
I promote a whole food, plant-based lifestyle. And whole food plant-based means that you're eating these natural foods and as close to their natural state as possible. And this involves eliminating salt, oil, and sugar as much as possible from your diet. And I try to encourage people to crowd out the meats out of their diet. We eat too much meat as a society, and many of these chronic illnesses are related to our large meat intake. We take in too much protein. There's fat and cholesterol that are associated with meat intake. And I also encourage people to eliminate dairy and eggs as well.
So that is exactly what we promote here on the Fabulous Health Show. So there was no surprise that you're here as a guest today. So how did you first become interested in the whole food plant-based lifestyle?
So I've always been interested in my health as a physician and treating largely ill people. I've always said, well, what can I do not to end up so sick when I'm older? And so I've always tried to eat, quote, eat right and exercise. And interestingly enough, about 6 or 7 years ago, I was exercising nicely. I was eating what I thought was a very healthy diet. I maintained a very good weight, and yet I was borderline hypertensive. I was borderline diabetic. My triglycerides were high. My cholesterol was like 247. And I thought, well, why am I working out 6 times a week with running and weights, and I'm eating what I thought was a really nice diet, and yet I'm starting around the age of 50 to have all these chronic diseases that everybody else gets. And I had the good fortune of going to Whole Foods and seeing Rip Esselstyn talk around that time. And he really challenged some of my belief sets about atherosclerosis. And he talked about how people can reverse their atherosclerosis and they can prevent atherosclerosis just by the way they ate. And that was something that I had never been taught as a vascular surgeon. It blew my mind, actually. I said, yeah, I didn't really believe him. I went away skeptical, thinking this guy's a quack.
Yeah, because you're the expert.
Yeah, well, I'm the expert, and no one's ever said to me, or there's nothing written in my books that you can do this. So why was I just going to believe this fireman who's just giving a talk at Whole Foods? But you know what what he did is what I'm trying to do now with people, is he introduced a concept to me that made me think. And then I did do a little bit more reading on this whole food plant-based stuff. I read his father's book, How to Prevent and Reverse Heart Disease. I read the China study, and suddenly I began to see there's actual real scientific data, and not just a little bit. We're talking lots and lots of scientific data that shows that our diet is central to the development of these chronic diseases. And it started to make sense. It started all over the place, how the American diet has been getting worse and worse and worse since the 1950s. I call it since McDonald's was introduced. And, we've gone into this fast food society, eat out a lot society, where we use a lot of, we're meat centric, and we use a lot of oil. We use a lot of sugar. I don't think anybody denies the oil and the sugar and the salt in our foods. And all of these things are bad for us. And so it was around that time that I went ahead and made the change. I actually have personal anecdotal proof, because I had some labs drawn around that time, and I had those numbers and all this data about my blood pressure, my triglycerides, my hemoglobin A1C. And then about 4.5 months after I made the change, I had to have an insurance exam, and they drew labs, and everything was normal. My cholesterol was under 150. My hemoglobin A1C had gone back to normal. My triglycerides were normal, and my blood pressure was back to normal too. So for me, within 4 months, all of these changes had occurred. But in reality, since I've become a proponent of this, I see changes occur in a matter of weeks. And that's what's amazing about this, is that we, again, manage all these diseases: a high blood pressure pill, a diabetes pill, a cholesterol pill, and people take these pills every day for the remainder of their lives. Or you can make some changes to your diet, and the diseases are gone.
Yes.
So that's what I try to teach, and I teach this to my patients, and some choose to listen, some don't. But what happened is that as I became more enthusiastic about this concept, my wife and I started our group, Plantbased DFW, and the idea was to teach people to do these things before they get the disease, before they get this ravaging disease that kills so many of my patients. And maybe we can affect people and help them change their lifestyles early on in their lives.
Yeah, so you're not just helping the people that are at death's doorstep, the ones that turn up to you, you're helping people before they get sick. In fact, that was my next question. So I'm so excited that you actually said that to me.
Sorry,
I want to tell you, no, you don't have to apologize for that. I think it's fantastic. I'm loving this information that you're giving everybody that's listening. But I heard a nurse recently say that one of her patients said, I don't have to worry about my cholesterol because my statin takes care of that. Now, that hit me in the heart. And I was like, honey, has nobody told you the truth? It's a Band-Aid, isn't it? It's a Band-Aid.
Yeah. You know, there's no doubt that statins are a valuable drug, but it's not supposed to be the first line, and it does not have the same extent or impact or benefit as changing your lifestyle to where you, through your foods, normalize your cholesterol. I mean, statins are a helpful adjunct, I think, but I'll tell you, the American Heart Association and the American College of Cardiology, they recommend diet changes as the first line treatment for high cholesterol, not statins.
Well, that's good to hear.
Unfortunately, we are a pill popping society, and the statins are just handed out like water instead of taking the time to teach people how to change their diet and lifestyles.
Yeah. So let's talk briefly about your patients. You don't have to give any information about individual people, but what sorts of results have you seen from people who were, as you say, you know, 50% of your patients used to die? What about the ones that do change their lifestyle? What about the ones that take on a whole food, plant-based diet, get the exercise, start sleeping well, stop drinking, stop smoking? Do you have any case studies, any success stories you can share without, you know, talking about privacy? If you know, you don't want to upset anybody's privacy.
Yeah, no, yeah, I won't. We don't have to tell patients' names or anything like that. But yeah, unfortunately, this lifestyle that we live, most of us are very, very ingrained in it. It's the way we've been taught since we were born, and so culturally, societally, we're very ingrained. So when I start to tell this message to patients, many are not. Some are even skeptical. Many are unwilling to make the change. It's funny how they trust me enough to cut them open and do a big operation on them, but many times they're skeptical when I tell them they can improve their lifestyle by changing their diet.
That's weird.
I mean, I have enough credibility to cut them open, and they believe enough in me to put them back together again. But they don't believe enough in me to say, hey, oh, well, maybe he knows what he's talking about when it comes to diet as well. So I say this to say that, unfortunately, the vast majority of my patients don't make major changes. But there are some, I'd say probably 5%, maybe 10%, that make a spectrum of changes. I'd say 5% really come on board with this. And those that do, uniformly, all of them say they're happy. They're so impressed with the results. They all lose weight. All of them, their cholesterol improves. Many of them, it's funny, I'm a vascular surgeon, not a primary care doctor or an endocrinologist, but I have cured many people of diabetes, and not through using medication, but by teaching them how to change their lifestyles and change their diet. So what I'm saying is basically we've helped many patients change the risk factors that cause atherosclerosis, and thereby improving their lifestyle. So
amazing.
I can give one example of a gentleman, young man. He's younger than me. That's another thing. Atherosclerosis used to be a disease of people in their 60s and 70s and older, and now I'm seeing it sometimes in their 40s and 50s. So it's accelerating because of our diet as well. So this is a young man. He was 51 years old and came in with carotid artery blockages, and it was nearly completely blocked. And so he was at very, very high risk of having a stroke. I talked to him about the surgery, told him it was a big deal, but I felt like he was going to do well. But and then he said, "He actually asked me the question, what can I do to stop this, or what should I have done? how can I make this so that I don't have to have the other side fixed sometime in the future? And
now,
so
that's a great question that you wish every patient would ask you.
Yeah, absolutely. But they mostly don't. And so I really sat down and I gave him a lot of time and talked to him about whole food, plant-based nutrition and lifestyle changes. I told him how salt contributes to hypertension, how fats and oils contribute to type 2 diabetes and obesity as well. And by the way, he had it all. He had hypertension, he had diabetes, he had high cholesterol. So by the time we had set up his surgery, which was about a month later, I went in to see him in the preoperative area, and I didn't recognize him. And so I was shocked, and he had lost 35 pounds. And
that's magnificent.
So we started talking, and this is one of my more recent, great stories. So that's why I'm smiling and I remember it. And he said, look, I was so scared, and I want to do everything I can to prevent from having to go through this again. And so he said he went home, he researched, he went to the websites I talked about, because I talk about, PCRM and some of the other websites and as resources, even my website, plantbaseddfw.com. And he said he went home, he did his research, and boom, right away, he went whole food plant-based. He eliminated salt, oil, and sugar from his diet. And as a result, he lost 35 pounds in a month. He wasn't starved. I asked him, were you starving? He said, no, I was eating as much as I wanted. Because as you know, these are low calorie, but highly nutritious foods. So you can eat as much as you want. And interestingly enough, in his labs that we do that day, his cholesterol was normal. His blood pressure was normal. And his hemoglobin A1C hadn't remarkably changed because it had been only 30 days.
Yeah, only a month. Yeah.
But I'm just hopeful, and I haven't checked one on him since. But I'm hopeful that when we see him again, that it will be getting better. If you don't know what a hemoglobin A1C, it's a marker or a measure of type 2 diabetes or diabetes, and that takes about 90 days to change. And so even when you make improvements, you're not going to see a change in that after 30 days.
Yeah, absolutely. So you mentioned the PCRM, and that stands for the Physicians Committee for Responsible Medicine. And I support them. I love them. They're my favorite organization on the planet. They're making lots of great inroads into education for physicians and trying to get much more nutrition information into medical school so that the vascular surgeons of the future have the lifestyle changes as an option in their toolkit, just like you do now, but you didn't before. So I'm really happy to report that. That's fantastic. So as well as diet, we talked about lifestyle, and you're involved with an organization called Walk with a Doc. So maybe you can talk to us a little bit about that. What is it? When does it happen? How do people get involved with that?
So sure, yeah. Walk with the Doc is a national nonprofit. It was established by Dr. David Sadgir, who was a cardiologist, and I think he's in Columbus, Ohio. And basically, it's a concept which is just to kind of give patients an opportunity to have access to a doctor while doing a healthy activity. So it's called Walk with a Doc. And typically on a monthly basis, my chapter here in Dallas, we walk 1 or 2 miles. People come and gather ahead of time. I'll give a little bit of a 5 to 10 minute talk on a health topic and answer some questions, and then we all go walk together. And I mingle back and forth with the walkers, and they get to ask me anything they want. So it's a very casual, non-healthcare setting where people can just hang out together.
And unfortunately, it stopped for a little while because of COVID. Is it back happening again? Because I've been meaning to come to it.
Right. So we stopped it during the 2020 surges. We reestablished it again, and now we have stopped it again because of Omicron. We will hopefully reestablish it again after the spike and the surge, and after it's gone.
Oh, I hope so. So if anybody's listening to this later on, you can just head to plantbaseddfw. Is it .com or .org?
.com.
.com, and then there's information there about your walking, isn't there?
There is. So I wanted to comment. You mentioned PCRM, And that's one of my favorite organizations as well. And I contribute to them on a regular basis, both monetarily, but I also give some lectures online for some of their various courses. And so I would encourage people to go to PCRM.com for further education about your nutrition and your diet. There's also a couple other organizations I'd like to mention. It's American College of Lifestyle Medicine, of which I'm a member, and I'm also board certified through them. And then also Plant Pure Nation. And the reason I'm mentioning all of these is because all of these groups are trying to help educate not only people, but future doctors. Plant Pure Nation, in fact, has a particular program where Dr. Clapper goes around to the medical schools around all over the country giving lectures and trying to educate medical students about the value of nutrition. And I think that's very important. I've done that myself. I think I've spoken at 4 or 5 medical schools here in Texas. It's one of our missions on our website is to educate physicians of the future. So I think that's a great place where we can make an impact, is teaching our young physicians the importance of nutrition so that they can teach that to their patients as well.
Absolutely. And there's been a great influx in people who are going plant-based. And so maybe we've seen the worst of the health in America and in Western countries like Australia and Canada and England and whatnot. Maybe we've seen the worst of it already. And now maybe because there's more doctors like you and more doctors that are learning about lifestyle medicine and more people that are becoming more interested in their health and going plant-based, maybe we're on the downhill now. So, you know what I mean? Like getting, maybe the next generation, instead of being more unhealthy, maybe they're going to be more healthy. We can only hope. Right.
We can hope and pray. And I mean, I agree. I see some momentum. We see momentum all over the world where plant-based diets are becoming more important. You see the plant-based sections in the grocery stores, which for me, it's amazing the options I have as compared to people who were whole food plant-based or vegan 10 or 15 years ago, when they didn't have any options in the grocery store.
Actually, let me ask you a question, because I have my opinion on this and I'd really like to know your professional opinion on this. There are some foods that I don't recommend to my my clients because they're high in sugar, salt and fat, but they could be what I would consider to be transition foods. So if one of my clients came to me and was on a standard American diet and they were going to Chick-fil-A and McDonald's and having pizza for dinner and all that kind of stuff, and they would say to me, what about the Beyond Burger? What about the Impossible Burger? What about the non-chicken nuggets? What about these things? What about the vegan cheese? If I eat that stuff, am I going to get healthy? And now, my opinion is it's marginally better. It's better for the animals, but I don't particularly think it's healthy enough to make a big change in your lifestyle. What do you think about transition foods like vegan cheeses and those processed burger options?
In a nutshell, I agree with you completely. And to expound upon that is that the other component of whole food plant-based nutrition, we talked about salt, oil, and sugar-free. The other component of it is to stay away from highly processed foods and highly processed foods. And because they're not natural, they're not the whole food. And so the term plant-based has been taken and put out there. So saying, so they're saying an Impossible Burger is plant-based, but it's not a whole food plant-based item. Okay, so it's a highly processed item, and a lot of oil has been added to it. Yeah, it's better for the animals, and yes, it's better than if you were to eat a regular burger, but it's only marginally better. And so there's this scale on when I give some of my lectures. I put a scale up on the screen of the standard American diet on one side, the whole food plant-based diet on the other side, and that's as far as that's the healthiest you can be is a whole food plant-based diet, non-processed foods, no salt, oil, and sugar. And that's what we all aspire to be. I'll be honest, I'm not there either. Okay. I'm somewhere around the 7, 8, or 9, but you can be a vegan, which is all plant-based, but there's a term I call the junk food vegan. You can eat potato chips, you can eat Oreos, you can eat Nutter Butters, and you can eat a lot of fried foods. You can put a lot of sugar in your stuff. You can use a lot of salt. And so that's only marginally better than the standard American diet. And I think the studies show that there's about a 6% improvement in health over the standard American diet. Whereas if you're all the way on the other side with the whole food plant-based SOS, there's a 70 to 90% improvement in your health.
Wow.
So is it okay as a transition food? I'd say yes. Anything to encourage people to move towards the plant-centric diet. But it shouldn't be the staple of your diet. It shouldn't be, instead of having a Big Mac every day, I'm having an Impossible Burger every day, because that's not really transitioning you very much.
No. And particularly for your patients, they're at the point of almost no return. They're going to die if they don't do something drastic. So going the whole hog, so to speak, without the hog, is the best thing for them. If all your patients went whole food, plant-based, they'd put you out of business and you'd be a happy man.
Right. Well, so, I do joke about that in my lectures. I say I am trying to put myself out of business. And by addressing younger people who haven't developed with chronic diseases yet, if they would just listen to what I had to say, I won't have any work down the road in the future. Now, the reality is I'm busier than ever, unfortunately. And that's why we give these talks, and why you and I do these things, is we just got to keep planting the seed. Just like Rip Esselstyn planted the seed in my mind. I even walked out of there saying he's crazy and I don't believe him. But here I am several years down the road, and I'm on board completely.
That's fantastic.
So by continuing to plant the seed, people will eventually hear the message. And I will be very honest with you. I don't expect everybody to live the same lifestyle as me. I'm just trying to get them to be healthier and to eat more plant-based foods and less processed foods and less meat. But they don't have, I don't tell my patients they have to be 100%. I try to help them improve on a daily basis. So I'll say, just start by eating more vegetables or more fruits, and by maybe taking out just a little bit of the processed foods, and keep trying to transition and trying to get better. It's a very daunting task to think that you got to get from A to Z overnight. And I'd rather them get to P and then stay at A. Okay. They don't have to get all the way to Z. You see what I'm saying?
Yeah.
So I just want them to be healthier.
Yeah. And that's noble. It really is, because it shows that you really care about the person rather than just, sticking things in their arteries and sucking out the goop. I think that's fantastic. So,
although I enjoy that part too.
Strangely satisfying. Okay. And, you also have your own podcast, which I hear you're not on very much because you're too busy being a vascular surgeon, but you and your wife, Maya, have a podcast called Plantbased DFW. I do understand she's changing the name, but let's not talk about that right now. Tell us a little bit about that. So we might as well give you a plug for your own podcast as well.
Well, thank you. Yeah. So we started the podcast about 3 years ago, and it was just a way to try to also increase our reach and to reach an audience outside of our local area. And it has grown. And yes, the idea was that we were both going to be the hosts of it, but it turns out that my hours are so restrictive that, there's only very few times that we'd be able to interview people. So Maya does a lot of interviews without me. And so when I come on, I'm maybe considered a guest host or a guest even. So sometimes, I might come on and she might interview me, or sometimes I might be a guest host with her when we bring somebody else in for an interview.
Excellent. So keep a lookout for that. And you can go to plantbaseddfw.com to find more about that podcast as well. So Dr. Rizwan, thank you so much for your time today. I really, really appreciate it. It was lovely to talk to you. That was Dr. Rizwan Bukhari from the North Texas Vascular Centre. Thank you so much.
Thank you, Terri. It was a great time. And, we could probably talk for hours and hours because there's so much more information.
Yeah, absolutely. Well, I'll have to have you on again maybe in a few more episodes, we'll think of another topic to talk about.
Certainly.
Thank you so much for watching the Fabulous Health Show and listening to the Fabulous Health Podcast. If you want to go back and binge watch all the episodes, just head over to fabuloushealth.net and click on the podcast tab. You can also subscribe to your favorite podcast platform right there from my website. And if you were curious about a whole food, plant-based lifestyle and want to take your health to the next level, you can join my online course, The Quick Road to Fabulous Weight Loss, or you can see me for private consultation. I'd love to help you obtain fabulous health. Have a fabulous day, and I'll see you next week.